Hi, I'm Dr. Frank Lista, and here we are in the recovery room at the Plastic Surgery Clinic. Just by the way, our recovery room is a state-of-the-art surgical facility with expert nurses who are specialists in recovering of patients after surgery, and we think it's the most beautiful recovery room in Toronto. Anyways, a mummy makeover is an operation which has become super popular these days. Basically, it's to correct the changes that happen in a woman's body with childbearing. So what we do in a mummy makeover is usually something to the tummy, which could be either a tummy tuck or liposuction, and often combined with something else. And the most common things we combine it with are breast surgery. And so the breast surgery could either be a breast reduction, a breast lift, a breast implant, or an implant and a lift. You see, what we're trying to do is correct the changes that naturally occur in women's body when they're having babies. And a lot of those things are sagging of the breast, loss of breast volume, loss of firmness of the breast, but also tummy problems. And the tummy problems are stretched skin, muscles that have come apart, and looseness of the abdomen with a little bit of fatty fullness. All of those changes are things that you can't really make better with diet and exercise, because diet and exercise can't make your tummy muscles go back together, and they can't get rid of loose skin. So when we're doing a mummy makeover, we're doing a tummy tuck and a breast surgery at the same time. The advantage of doing them at the same time is that the recovery is fairly easy, and the time off work or the time off taking care of your family is the same as if you were having just one operation. And one operation is easier to get over than two operations. In fact, we think it's actually safer. My partner, Dr. Ahmad, and I have just published a paper in the Aesthetic Surgery Journal where we looked at the complication rates, and they're very low. And the complication rates for having both operations is the same as having one operation. And so it's a really safe operation to do at the same time. There's a little bit of cost savings because there's just one anesthetic, so we pass that cost savings on to the patient. And it's easier to have one operation than two. So our study shows that it's perfectly safe to do both at the same time, and it's a huge convenience.